Hello and namaste everyone. Today I'm going to discuss about the Lefort fracture lines that were described in 1901 by the French surgeon René Lefort by applying blunt forces to the cadaver heads and then studying the fracture lines. So before going into that, you need to know about the buttresses that are found in the face. They are divided into the horizontal and the vertical buttresses. Horizontal ones consist of the frontal bar running across the frontal bone, the horizontal one running across the orbital rims, then the alveolar process of the maxilla, alveolar process of the mandible, and the lower border of the mandible. The vertical buttress consists of the nasomaxillary buttress, the zygomaticomaxillary buttress, and the pterygomaxillary buttress, which is connected with the pterygoid plates behind. Now, the classification of Lefort classically is described as Lefort 1, 2, and 3. Marciani has further given a subclassification with types A, B, as well as Lefort 4, where there are combination of different fractures, because always remember that on one side there can be a Lefort 1 fracture, on the other side there can be a Lefort 2. The classical descriptions are not seen nowadays because they are all high force traumas which lead to these facial fractures. So the Marciani classification is something that you can look up easily online and go through it. So we're going to start with Lefort 1 classification. So remember that you can be given a skull in the viva examination and be asked to draw these fracture lines. So we don't need the mandible for this. I'm going to stick to the mid face. So remember that the impact happens in the center and then it goes along on either side of the face. So in a classical description of type 1 Lefort, it starts with the nasal septum. It goes outwards to the lateral pyriform rims. It then travels horizontally above the apices of the maxillary teeth, crosses below the zygomaticomaxillary junction, and it goes towards the pterygoid plates. Now remember, these pterygoid plates are important because all three of them are going to find their way to these pterygoid plates, which are the part of the sphenoid bone, and they are an important landmark. So similarly, it will happen on the other side as well in a classical description. They will start from the nasal septum, along the lateral pyriform rim, zygomatico-maxillary junction, traverse behind to go till the pterygomaxillary junction. Now, this is also known as a Guerin fracture, which is a transverse fracture. So there's a classical sign here called the Guerin sign, where in the patient is a clinical feature. You can find ecchymosis over the greater palatine foramen region. Now, in case of Lefort 2 fracture, which is also described as a pyramidal fracture, this fracture actually starts from the nasal bridge. Now, it can start at the frontonasal junction or it can start just below this nasofrontal suture. Once it starts from here, it then travels inferiorly to the lacrimal bones and it goes along the inferior orbital floor. Now, an important point to remember here is that once it's reached the rim, it's going to actually come out of that area and it's going to go through the inferior orbital foramen. Now, this is an important landmark. It's going to cross through this foramen. So remember, wherever there are foramens or wherever there are suture lines, there are potential areas of weaknesses. So that's where the fracture lines like to go. Once it's crossed this inferior orbital foramen, it's going to go through the anterior wall of the maxilla and again go under the zygoma, again across the pterygomaxillary fissure and meet again the pterygoid plates. Similarly, it's going to happen on the opposite side. So the nasal bone, lacrimal bone, orbital floor and rim then go and find its way to the inferior orbital foramen, through the maxillary sinus, down till the zygomatic region and behind till the pterygoid plates. So this, you can see, forms a pyramid, a triangular shape, a pyramidal shape, and hence given the name. Now in this case, the clinical sign that you can see is a pseudo-telecanthus. So in this case, because of the edema over the nasal bridge, it will give you an illusion of the telecanthus and it will not be a classical one, which you can see in case of Lefort 3. Now coming to Lefort 3 classification, it again starts from the nasal bridge area or the nasofrontal suture line, and this one is going to again go through the orbit, but it has obviously a little different course than LIFO2. It's going to go upwards, hence it's known as a craniofacial disjunction. So it's going to start from here, find its way across the nasal bone, go inside along the medial wall of the orbit through the nasolacrimal groove ethmoid bones. Once it's gone over here, it's going to go along the floor of the orbit, stay inside along the floor of the orbit and inferior orbital fissure over here, find its way to the lateral orbital wall, go across through the zygomatico-frontal junction, and now the lateral part you have to remember is that it's going to go through the zygomatic arch as well. So it doesn't stop here, it goes on the zygomatic arch, and again from there it's also going to find its way back to the pterygoid plates. So remember, these pterygoid plates are a favorite of all three fracture lines, and they're going to find its way over here. In case of LIFO3, what happens also is when it's crossing this area, it leaves an impact inside to the nasal bones as well, because of which it can fracture the ethmoid bones, and intranasally it can fracture the vomer as well. So again, find its way across through the suture line and zygoma and goes behind. So these are the three main things that you have to know. Other than that, there are approaches of how to fix these fractures. I'm not going into detail for that, and then you can find the information again online for that. The important question here that is also asked is that so LIFO advancements are also done when you want to correct the midface, change the shape of it in case of maxillary retrusion or prognathism, retrognathism. So in that case, what is the difference in the LIFO advancements that we do and the LIFO fracture lines that happen? Again, the main difference is this pterygoid plate. So it lies in these pterygoid plates. So the fracture lines find their way to these pterygoid plates, but when we fracture these lines to cause the advancement, we don't touch this area. So the pterygoid plates are not involved in those cases. So that is all about the LIFO fracture lines. I hope you found this useful. If you have any questions, please leave them in the comment box and I will try and help find answers for them. Thank you.